Hello and welcome to 5 Minute Pharmacology. Today we're going to be talking about the drug ketamine. Ketamine's trade name is Ketalar or Ketaset. Classification is a dissociative anesthetic, and it's carried 500 milligrams in 5 mLs. We carry 2 vials of this in our drug box. Pharmacology behind ketamine is a non-competitive NMDA receptor antagonist. When given for sedation, within our agitated or violent patient protocol or RSI. It functions as a dissociative, and when we give ketamine and the patient has that dissociative feeling, what that basically does is it's a temporary mental state where they detach from their surrounding, meaning the person becomes less aware of what actually is around them, and they start to feel disconnected from everything, almost disconnected from their body. And this may cause your patients to become agitated and give them this really unpleasant feeling. However, this is not very common in the pain management doses that we give that are pretty small. So it is also an amnestic, and an amnestic is just dealing with or pertaining to memory loss. And then it does produce, it is an anesthetic producing anesthesia, which is basically the loss of sensation or awareness of unconsciousness. And it is an analgesic, which is and can be used to treat pain at low doses. So it does function as those 4 things: a dissociative, an amnestic, an analgesic, and an anesthetic agent. So when we use this, it is for delirium with agitated behavior, an induction for inhibition, and for pain control. Some contraindications of this is patients who have some type of angina or chest pain. And for these patients, the reason why it's contraindicated is it can cause some mild vasoconstriction, um, and it can also cause a little bit of a bump in blood pressure and heart rate, which can increase myocardial demand. So if the patient is, let's say, having an NSTEMI or STEMI, we would need to opt and follow the ACS protocol for treatment of pain and not give ketamine as it's not listed in that protocol. So just be cautious of that. Um, CHF, pregnancy, and ketamine allergy are also in those contraindications. So some precautions and side effects is patients, if ketamine is given extremely rapidly, so if you give this in the rapid IV bolus, um, you patients may become apneic or have periods of apnea. So just be aware of that happening. We should try to give this medication slow IV push when given. So this medication can also cause laryngospasms, hypersalivation, increased airway secretions, an emergence reaction, and so that's basically the undesirable behavior a patient could present to you when waking from sedation. So, look out for those things. Patients may become extremely agitated or violent coming out of these and having pretty extreme type of nightmares. And these are usually when ketamine is reaching its half life and the patient's starting to regain or lose that anesthetic effect and kind of waking up from conscious into consciousness. So just something to look out for. Usually, we don't necessarily see that in the field because our patients have already been dropped off, and by the time that medication hits that, we're usually not there. We're away from the patients. But this is something that within the ERs they deal with quite often. So patients may also have nystagmus, and we need to use caution when giving this to patients who have schizophrenia. So this can be given IV, IO, and it can be given intra nasal and IM as well. So we'll go over some of this here. So the IVIO route, the onset is pretty quick, less than 1 minute. The peak effect is within 30 seconds to 5 minutes, and the duration is about 10 to 45 minutes. When this medication is given intramuscular, the onset is about a little bit longer, 3 to 4 minutes. Its peak effect is 3 to 12, and it lasts longer. So its duration is 25 to 60 minutes. It is given in 3 protocols. So the agitated or violent behavioral emergency protocol, which we do 4 milligrams per kilogram, IM, max of 250. So we can give max of 250, see how the patient does, make sure you give it some time before you decide to repeat that dose, because the onset of action of IN ketamine it can take up to 4 minutes for this to start working. So just be cognizant of that. Pain management, we're giving small doses, so 0.25 milligrams per kilogram IVIO, slow IV push to a max of 25 milligrams per dose, to a maximum of 100. So a way you can think about giving this slow is just diluting it into 50 mLs. You can put it in the bag and just kind of infuse it slowly over 3 to 5 minutes, or you can dilute it in a syringe and give it slowly. Just make sure you're giving it slowly, not doing rapid IV bolus pushes. And then for RSI, for patients that are equal to or greater than 15 years of age, the induction is 1.5 milligrams per kilogram to a max of 150. And then after you sedate them, the post-paralytic sedation is 1 milligram per kilogram with a max of 150. So um, that I do have notes at the bottom here that just state, if you have a patient who's having a reaction to scorpion stings and you want to treat their pain, I would opt for more opioids like fentanyl would be appropriate, because when given ketamine in a small percent of patients, they can have this emergence reaction. So, um, anyhow, I hope you learned something today about ketamine. Make sure you like and subscribe. Thank you.